it's finally the time of your embryo transfer, and this is one of the most exciting days that we have here in the clinic. What we will have you do is you will come into our clinic a little bit in advance. We're going to ask you to drink a fair amount of water ahead of time. We need your bladder to be full because all of our transfers are done with ultrasound guidance, and having your bladder full allows us to see the uterus more clearly so we can have a more accurate transfer. I want your bladder to be full, but I don't want you so uncomfortable that you're doing the I have to pee dance. We will get you signed in, we'll get you changed into a gown, and we'll get a designer bracelet with your name on it. When you're all ready, we'll bring you back to our transfer and procedure room. You'll lay back and you'll put your feet up in the position you've gotten very used to as you've been going through all of these egg retrievals and ultrasounds, and you'll slide down to the edge of the bed. We're going to put a speculum in. And when I put the speculum in, I can't use gel because we're doing the transfer that day. I do use fluid to clean off the cervix and the inside of the vagina, however. So later, when you sit up and you see fluid come out, that is just the fluid that we use to clean with. Embryos do not fall back out. Once the cervix is clean, we're going to put a guide catheter through to make sure that we can get in, and that's done under ultrasound guidance. Once everything is all ready, we'll let our embryologist know. She will load up the catheter with the embryo and then bring it out. We check the name band about 16 times. I'm joking, but it's actually checked quite a few times as we're going through this process. And then we'll put the embryo through the catheter, watch on the ultrasound, and very gently insert it into the uterus. Now, there's no such thing as embryo glue. And so what we're doing is we're putting that little dot of fluid that you can watch on the ultrasound inside the uterus and making sure that it's staying where we want it to. And then we very slowly take the catheter out. The embryologist is going to tell us that the catheter is empty. We want to make sure there's no freeloaders who are hanging on to the catheter where they shouldn't be. We want to make sure that it's in the uterus. Once we know that everything is good, I'll very gently take out the speculum and you'll slide back on the table. We have you stay flat for about 20 minutes or so afterwards. We'll move you to a bed and go out to the recovery room. You'll hang out there for about 20 minutes and then you can go about your day pretty much like normal. Now, I don't want you doing any major activity that day. Walking is fine. The stairs in your house are fine. I don't want you out running a marathon, doing anything crazy that day. I'm pretty sure if you do laundry, the embryo won't stick and you shouldn't do any laundry or cooking or chores that day. Once that is done, we'll give you medications and the instructions really to continue your medications the same as you have been. And 10 days later comes the important day where we're checking the test and seeing if you're pregnant and calling you with those results.